Musculoskeletal rehabilitation, including physiotherapy, needs to move towards a broader biopsychosocial understanding of musculoskeletal conditions and the delivery of high-value care for people with persistent pain conditions, in which a patient-centered approach is a key feature. However, it has been reported that clinicians experience difficulties with integrating patient-centered care principles into their clinical practice. Based on a focused symposium about patient-centered care for patients with musculoskeletal conditions, held during the online 2021 World Physiotherapy Congress, we recently wrote an article in Musculoskeletal Science and Practice. The purpose of this article is to share key elements of the content of this symposium with a wider audience, aimed at enabling clinicians to enhance patient-centeredness in their current practice. Patient-centered care is characterized by regarding the patient as person, a biopsychosocial perspective, sharing power and responsibility, and therapeutic alliance. In such an approach, establishing meaningful connections, shared decision-making, self-management support, and patient-centered communication are essential components. A meaningful connection is one in which patients and clinicians feel seen, heard, and appreciated, and is developed through professional and personal acknowledgements that bring them closer together. Considering the clinical interaction's dynamic nature, there are 3 ways clinicians can consciously form connections that align with patient-centered care: acknowledge the individual, use the body as a pivot point, and giving of self. An explanation of these terms and examples are provided in the published article. Shared decision-making involves mutuality, combining the skills of healthcare professionals with the patient's experience. Shared decision-making considers the person's context, knowledge, needs, values, and goals. The core components of shared decision-making include identifying and clarifying the issue, identifying potential solutions, discussing options and uncertainties, providing information about the potential benefits, harms, and uncertainties of each option, checking that patients and professionals have a joint understanding, gaining feedback and reactions, agreeing a course of action, implementing the chosen treatment, arranging follow-up, and evaluating outcomes and assessing the next steps. Self-management support can be defined as interventions that aim to equip patients with skills to actively participate and take responsibility in the management of their persistent condition to function optimally. Recommendations to provide self-management support in people with musculoskeletal conditions include: focus on therapeutic alliance, which consists of collaborative goal setting, shared decision-making, and building a strong therapeutic relationship. Use coaching to facilitate behavior change, a healthy lifestyle, and building self-efficacy. Support patients to obtain general self-management skills aimed at problem-solving, decision-making, using resources, action planning, self-tailoring, self-monitoring, and creating partnership. Provide support with regard to the patient's biopsychosocial barriers, needs, and achievement of their goals. Patient-centered communication requires attention to what we communicate and how we communicate across the entire clinical interaction, including interview, examination, and management planning. Clinicians need to be open, reflective, aware, and responsive to verbal and non-verbal cues, and demonstrate balance between engaging with the patient and writing and typing notes during the interview. During the examination, the clinician encourages patient involvement and facilitates disclosure of beliefs, fears, and concerns. This is a collaborative learning process that promotes self-efficacy and ultimately self-management. Patient-centered care is important in people with musculoskeletal pain conditions. This includes meaningful connections, deciding together, and self-management support. Implementation is a challenge, especially in low and middle-income countries. Clinicians need to reflect on their own beliefs and practice. A global effort will be necessary to achieve change.